Len?
We have a
I'm just trying to no, Len, come. Jennifer? Want to come first?
I can't believe it.
With milk.
Great, Jeff. And how is it? Isn't it great that you're working with Nora? Well, you were both stars. I'm actually missing class today. First term. Well, bioethics will help you, right? But I grew up in that camp, so I have something to cover.
Did you have someone live stream the event in the class?
Like,
Homer?
You guys did a great job.
Really,
Thank you so much. We appreciate it. Would you like
to take some notes. If I need to.
This is for everyone around the table.
poor guy who was distracted.
Hello, everyone. Let's get started. I think some people had to leave because of prior commitments. So the purpose of this small gathering is to really follow up in a relaxed way on the discussions that we just had at the UNGA, and the great ideas and recommendations and next steps that we can carry forward. My name is Samer Jabour. I'm a member of the Faculty of Health Sciences at the American University of Beirut. Also serve with my colleagues Jennifer Leaning and Iman Wahed as co-chair of the Lancet AUB Commission on Syria. So before we start our discussion, I'd like to give the floor to our colleagues at the Lancet. They have an interesting idea that we're very much supportive of. So Rebecca, can you please introduce yourself and your colleague and share your idea?
Yes, I'm Rebecca Cooney. I'm the North American Executive Editor for Lancet. And so I haven't previously been involved in this commission, but as one of the ways that we want to help kind of promote and continue the work, especially now against the backdrop of UNGA, we were hoping to get some little video vignettes of some of you sort of talking about kind of what you feel the things that need to be drawn out of this, but in a really succinct way that we can promote on social media and take this forward. So it was such a great discussion so far, and I'm really looking forward to chatting with the community. So we're thinking of maybe just doing something in the hallway. And this is my colleague Erin Van Dorn, who's also in the New York office down the street. So whenever we have a chance after things settle down, we'd love to pull a few of you aside and chat.
Okay, great. Thank you very much. Now, in addition to the colleagues I introduced here, we also have with us, for those of you who were not at the event, Len Rubenstein from Hopkins, who's chair of the Safeguarding Health and Conflict Coalition. The coalition and the commission are co-organizers of the event today. And we have with us also Homer Venters, who was the moderator and the director of programs at Physicians for Human Rights. Now, the members around the commission, around the table from the commission, also include Ahmed Taraji, who is the president of the Syrian American Medical Society. I think we'll...
we also have some analysts who've been working with the commission who are around the table.
Wonderful.
So Rania and Abi, would you raise your hands? Is there anybody else working on the research teams?
Perhaps because we are a small gathering, perhaps we'll go around the table real quickly and just state a name and where we're coming from. Please.
I'm Kara. I kind of have dual allegiances. I'm here with Watchlist, but I'm also a student at Johns Hopkins studying public health.
Thank you. I've already introduced Ahmed, who's also in the Please Talon.
Yeah, Talon Kanaan. I'm working with the Union for Medical Care and Relief Organizations, USSF. So, of course, permanent.
If I might encourage colleagues to speak up a little bit, I think those of us at the ends of the table may or may not necessarily hear very well. So Talal Kanaan, thank you very much.
I'm Brooke Reynolds, and I'm here with Independent Diplomat.
My name is David Lilly. I'm the Executive Director of Syrian American Medical Society.
My name is Sharu Sharif with UNICEF Health Section, working on health system strategy.
I'm Rami Khouri from the AUB main campus in Beirut, where I teach journalism and do research.
Allison Freeland, AUB, New York office. Welcome, everyone.
So Allison has played a key role in organizing this event, so we're grateful to her and to the whole team of the New York office for organizing the event and for hosting us here, and that goes very well to the next person who's involved intimately in this team.
Ada Porter, I'm also with the New York office.
Megan Scanlon, also with New York office.
Hello, I'm Aaron Van Dorn, I'm working for the Lancet.
Julia Brookson with the Harvard Humanitarian Initiative.
Rania Ahmed, I'm with SAMS and FXB.
I'm Abhishek Bhatia. I'm an analyst at the FXB Center.
I'm Paul Galatowicz. I'm the Executive Director of Socioanalytics. We do education programs for university faculty and graduate students.
I'm Monica Sweeney. I'm in global health from City, New York at Downstate. I'm glad to be here.
Dennis Villa, IT Manager in the New York office for AUB.
Eric Idris, Communications at AUB.
Barbara Rossica, Communications at AUB.
Sujatha Venkathy, Advancement at AUB.
My name is Robert Courier, and I work with Paul on graduate programs.
I'm Nazan Jihadi. I'm an MBA student at
So thank you everyone for being here. I hope you've had a good lunch. There are also sweets on the table for those of you who didn't get a chance. Please enjoy yourself. So let me hand over right now back to our co-organizers, represented by Iman and Len, so that they can perhaps give us some impressions about about the event, and perhaps we can turn it over to everyone afterwards.
I'll defer to you. You're the program.
So thank you all for being here. I think this is for those who were with us at the UN this morning, and for those who watched through the live streaming. I think you all agree that I thought that it was a very lively panel. A lot of good points were raised. I think there was a lot of transparency and sort of clear ideas and suggestions. I've sort of stressed the whole issue of role of universities in this issue and similar issues. And academics are usually hesitant to engage in topics and themes that are political, especially if they are divisive. So universities try to stay away from these issues, hoping that the storms might pass by and then they can reposition themselves. I think AUB nowadays has no option. AUB has always been part of the region and has always been engaged. But over the last decade, especially over the last 6-7 years, AUB has no option but to be engaged one way or the other. And as an academic institution, we have a role that could be different but complementary to the roles of other organizations, civil society and government organizations and UN organizations. The university could bring in again the whole issue of documentation, the whole issue of analyzing what's happening around us, and try to make some sense out of events that make no sense at all. And the fact that the war in Syria and the sort of the again the instability that actually is affecting most of the Arab countries, again require us to try to understand what's happening politically, historically, put things in perspective, and because the impact of what's happening now is going to last for decades and decades. We've spoken today about attacks on health workers and health facilities. And for many, the idea sometimes sort of is narrowed down to the immediate, that you're killing a doctor, you're killing a nurse, and that's impacting the delivery of service. You're blocking things and destroying the hospital. And we think about the immediate health delivery. The reality is this is going to impact the health system for years and years to come. And it's definitely a loss, and it's definitely a tragedy. But at the same time, it could be an opportunity to ask questions a little bit differently. And academic institutions can be involved in asking questions like this. How can a health system be rebuilt? What do we learn from an experience like this? What does war mean? How do we build on the agency and the resilience of people? What are the good stories that we can carry through? And the whole issue of education, of training, medical curriculum, nursing curriculum, public health curriculum. I'm the dean of a school of public health, and I have to say, all of these issues are not part of our curriculum. Our students are not actually trained in issues like this. They're not exposed to issues. Sometimes in a lecture here or a lecture there. But again, we shy away from these things. One, because frankly, we don't know much about them. So our engagement in the whole issue of humanitarian law and international law is alien even to the health professionals, regardless of the school. So through this commission, we're actually have the opportunity and the pleasure to work with other commissioners who are bringing years and years of experience. So it's that cumulative experience that is transforming our work and even our thinking within the faculty. And it's not an easy task, and it's not a smooth one. And I've raised that at least at the level of the academic institutions, and Dominique Charon from IDRC asked the question of the role of academic institution in our part of the world. And I think that's crucial. It's crucial that we take the lead. We partner with others, we ask the questions, we move things forward, and it's okay if we don't have the answers, and it's okay if we don't have the capacities, but if we don't try to ask these questions and engage with them and work with others, we can never build that capacity within the university. We have the sort of the strongest support from the leadership within AUB of moving this thing forward. But I'd like to ask Len to again sort of add some comments, and I would like Jennifer, who's our esteemed co-chair of the Lancet AUB Commission, because she has also years and years of experience as an emergency physician in both the human rights and now with the commission, and perhaps start reflecting all together on the question that Homer actually posed to me. It was the end is sort of the next steps and the follow-up thing. It's not easy. I thought Homer, you just gave me the easiest part of the work. What are the next steps? And frankly, it's not easy to do. And so let's try to brainstorm a little bit about what can we do next in our our sort of different perspectives and capacities. Glenn?
First of all, I don't think we have sufficiently recognized Samar, who happily,
thank you,
happily had no idea how impossibly difficult it was to organize a side event at the UN with member state sponsorship, especially this week when all the prime ministers and presidents are in town. So he was tireless, he was indefatigable, he was relentless, and that's why this happened. So
I have to admit, Lan, that when Samer raised the idea to Jennifer and myself, we were reluctant. And
we were unanimous. Like, don't do this.
And told Samer, "Are you crazy or what? How are you going to pull this within 3 or 4 weeks?" And he said, "You have our blessing and support, but you're doing it on your own." And he did. Yeah. So thanks, Samer.
I want to give 2 contextual points about today, what went on today. Number one, I think despite the fact that the carnage in Syria just doesn't end, and nothing that is, no amount of condemnation and no amount of attention has stopped the bombing of hospitals and the attacks on health workers. And I think that's a terrible defeat, but I think it's all, what today showed is that there's no resignation either, that SAMS and other groups, AUB for sure, is not going to just throw in the towel. That is really important. The second is it was a reinforcement having this event, and I kept telling someone, I said, I don't care how many people come, if 4 people come. You have 4 member state co-sponsors, that's going to reinforce their commitment, which it did, and there were other member states who spoke up. So today was really important in getting some of the states here at the UN to recommit and to really try to figure out how they can act. And I also think, and that's really important because the other contextual factor is that in the last 16 months, after the Security Council passed a resolution, there's been complete failure to do anything to make it real and to implement and take the steps called for. And mostly that's because of the Russian veto at the Security Council. But it's not the only reason. And I think today really reinforced the idea that these states have something to do, could do something. And I think our next steps are to help them take concrete actions. There are many concrete actions we discussed today. We can discuss it again now, we can discuss it later, but I think we in this room need to follow up with these governments. The Netherlands, which is joining the Security Council, with the UK, which wants to be a leader, even though it's selling arms to the Saudis, and certainly with Spain and what's the fourth? Canada wants to be a leader on this issue. So we really have opportunities, and I think we just have to figure out how we take advantage of them.
Jennifer?
Yes, thank you. I was struck by how many people were mentioning the need for monitoring and documentation. And from member states, unbidden, the ones who raised their hands to talk about it, from the ones who were at the podium, and certainly, I think, uniformly across the panel, the formal panel, people were talking about this issue. And to me, this is a triumph along the lines of what Len is talking about, where there's no resignation, even though enormous hardship and cruelty is still being meted out on the terrain of Syria and adjacent borders. That there's a real mobilization of recognition that in order to get the member states to put their feet to the ground in terms of the resolutions that have been passed by the General Assembly or the Security Council, but also in terms of documenting violations of IHL that will then have traction if they are adequately documented, requires serious and skillful and imaginative, but still technically sound documentation, which first of all is monitoring. In other words, you have to be watching and figuring out what you're monitoring and figuring out what categories you're monitoring, and then you start documenting. then you learn that one category is wrong and you have to fix it, you come back, or the situation changed and you have to add something else. It's iterative, but you've got to start and then keep going through the entire series. And this is one of the aspects of the Lancet Commission that is, I think, going to prove very fruitful and generative of a number of other efforts. And we also are relying on a number of other efforts as we are gathering the data to try to put it in one place in what is turning out to be a relatively short commission report, given how much actually has been documented. I mean, we're saying this and nobody's contradicting us, that this is the best documented war in modern times. And it is, in fact, the best documented if we had adequate access to government-held areas. And we're doing our very best to do that. And some of the data sets, that is, some of the ones that are coming from the Safeguarding Healthcare and some of the ones that are coming from WHO as they begin to show a little bit of what they have. We're going to have some data sets from that area as well. But the bottom line I was thinking is that in terms of IHL, in terms of war monitoring and reparations, in terms of figuring out who's been killed and what their widows and families or their male spouses and families need, we have documentation that if we could mobilize various sectors within the UN agencies, the civil society, and some of the major organizations that were present, we actually could begin to move towards significant new understanding and mobilizing a more alert world, so that the next time in Yemen is already now. And you notice how many of the diplomats merged Yemen with what we're talking about, because that is clearly the atrocity that's on their doorstep now. But it's going to be, I think, an implant that we can collectively shape and then collectively claim as part of our work going forward. And so I thought it was a very, very exciting and important panel discussion. And the audience, I agree, Len, with what you said, that it's very impressive, the people that Sama managed to gather. That's going to go far, I'm hoping.
So, perhaps if Homer and or Ahmed have any brief comments, you've all also served as panelists / moderators. So, if you have any comments before we open it to the floor to see what is it that we can take forward actually from the discussion. For example, the 8 steps that Len discussed, or some of the steps that that Iman has mentioned, or the ones that you have also called for, the 3 important priorities.
Well, I mean, thank you for the initiative, and certainly we appreciate the support and the partnership we've been getting together on a personal level, as well as the support that we have over the years. Certainly, as you all know, it's very painful to have this experience, but we've learned that this experience needs to be well documented, as mentioned Jennifer, need to be shared. It's a team effort. So it's all of us building structure that we say, well, this can be replicated in other places to help people in other places and other wars. With that, I think the AUB and the Lancet take a significant leadership position of building that partnership, which Lynn probably can explain that not exist. It has been more than philanthropy on one side with God, us with HR, us with Hawkins, that didn't exist to be a platform. And I think that's a very important model, especially as you mentioned with wars echoing in the Middle East. That model needs to continue to be there, that this coalition, this partnership needs to be expanded. So that, I think that's very important. I agree with Len about the 8 steps on them, how we're going to process this if there's blockage in the Security Council. But I think we should continue to aim high in the concept, saying this is well documented crime, that this is what you have to do for it. And I can't forget, I'm sorry, you mentioned that not only on the international community, we have to hold every single country accountable and say, well, if you know this is an offender, you should not allow that offender back into your country as part of free treaty or a part or some political agreement. We do not want to see those offenders walking down the streets of New York, London, and Paris, because eventually this is where they want to go. So we have to ask those European countries to say, like, you should not allow them into your country. They need to know that. If we can't pass that international criminal court, they should not go into the context of their some criminals. But again, I think the partnership is very important. And also in Beirut actually. So I mentioned London, Paris and Beirut as well. So they should not be there as well.
Yeah, you're getting to like that city, aren't you?
Yeah.
You want it for yourself.
So I think that's bringing that unique position of partnership, collaboration, and this is one segment that we talk about human rights, but also the other part of the deal, having future and so on, is also important to be under the umbrella of Lancet and Commission, and congratulate.
Yeah, we at PHR, we're trying to develop a little bit more our epidemiology skills. That's my background, and I think that one of the things that struck me recently, spending some time in northern Iraq, and I'm asking all of our teams to kind of think about this, is this approach that the researchers will know a lot about, called CVPR, community-based participatory research. But it goes towards something that we were talking about just earlier, which is that our efforts have to reflect the needs and the priorities of people on the ground. So when you work in whatever armed conflict in the local context, it's that I'm sure, ultimately the most important thing is for the atrocities to stop. But there are also important things that you learn along the way that can be really meaningful and actually could contribute to the ultimate goal. So the docs, our team, every day is talking to doctors and other folks on the ground to try and do this triple source verification of the attacks. In there, physicians are constantly asking us for help to document other things. They are eager for some support and capacity building in how, Istanbul protocol style or other types of approaches to document. And so the notion for me of using CVPR as the context for our research teams is to say, and not that they don't do this, but they think in terms mostly of like a technical grant or a capacity building exercise, but it is in the asking of the question, what are the questions that are important to you in the midst of the atrocity and the bombs dropping? What things would be most helpful? And this is where academics have all the tools but are not engaged in the gritty day-to-day tough situations. And they'll ask the question somewhere else, and then they'll come and say, do you want to answer these questions with us because we have $1 million? But to start at that first spot that we all are at, which is, what questions should we ask together? And then have a really meaningful partnership that includes policy and advocacy and documentation, but also includes research that we develop this capacity together to ask the question, because hopefully we leave, or whoever the NGO is, isn't a permanent feature of the landscape. It's that you help build up an independence there that's legitimate. So I think that's something that I've really been thinking a lot about.
The floor is open. So